Hello. There we go. Now we're good to go. Hi, welcome to our today's webinar. I'm William Huckabee. I'll be sort of ringmaster of today's events. The Health and Safety 101 must-knows for food business owners and operators such as yourselves. Um, so first, just a little bit of housekeeping. First of all, the microphones will all be muted today, just to avoid background noise for everyone. And please use the chat function if you have any questions during the presentation, but be aware there's also an opportunity for questions at the end. As I said, I'm William Huckabee. I'm the business development manager here at Food Alert. John is going to be doing most of the presenting today, luckily. He's our client service director. And if you want to just say a few words about yourself, John.
Good afternoon, everybody. Yeah, John Haswell, Client Services Director. I've worked with Food Alert for 8 years. My anniversary's just gone. Working with lots of different clients within hospitality and been working in the sector for 35 years. So carry on, Will.
All right. So some of you may be very familiar with us, others of you may not. So just so you know, we have been helping over 2,000 hospitality businesses all around the UK for over 30 years. Some of the major brands that you see in front of you right now, but also down to a mom and pop shops, little cafes that don't serve any food. So we really do top to bottom. It's a very customizable solution, which I think you'll see a lot of today as well. We're going to be doing an overview of the health and safety duties and legislations for you, covering the core pillars of compliance with regard to health and safety, and of course, going over the implementation and cultivation of health and safety training and communication. All of this presented by John from here on.
Wonderful. Thanks, Will. So we're going to start off with a poll, just to make sure that everybody's awake and listening. So the first question we'd like to ask is, when did you last review your risk assessments? Okay, so there's a poll just going to be generated. So if you can answer the question, we promise not to share the information with your auditors, enforcers, or whoever might be watching. So 6 months, 12 months, within the last 2 years, longer, or are you unsure? It's important that you know. We ask the question because at the end of the day, if you're required to write risk assessments, then it's important that those risk assessments are effective. Right, so I'm hoping by now we've got some good responses. Emma, can you share what the consensus is, or? Okay, within the last 6 months. So round of applause, first of all, for the majority of the people on the call. Fantastic. Within the last 12 months, which 12 months, which absolutely is bang on track. And those of you that are unsure, I'm sure that after this call you'll go back and check. So thanks for participating in that. We're going to have a few more of these little polls as we go, just to sort of make sure that we make it interactive as much as we can be, because your microphones are turned off, and keep everybody engaged. Right, so if we can change the next slide. So what we'd like to do is start off by telling you a little bit about the background of health and safety. So health and safety within the UK is governed by the daddy of all acts, which is the Health and Safety at Work Act. The Health and Safety at Work Act this year actually had its 50th anniversary. A fantastic piece of legislation which remains as relevant today as it did 50 years ago when it was first introduced. When it was first introduced, there was a lot of issues with health and safety within the UK, lots of fatalities, and the Health and Safety at Work Act, etc. Don't forget the etc. Act 1974 brought together all those bits of legislation under one piece of legislation under the Act, and made it possible for common enforcement across lots of different sectors. But in terms of the detail, so the requirements really of the Health and Safety at Work Act were to ensure that there was a safe workplace, and that safe workplace covered everything from people getting into and out of work, welfare, looking at the environment of the workplace, and making sure that, as I say, it was safe for everybody. So the etc. means everyone, so not just people at work, but people affected by work activities. It introduced the requirements for training to make sure that suitable training information was provided to employees, and it made it made it a requirement for those businesses that have 5 or more employees to have a written policy and to have written assessments. So just to make sure that things were written down so that they can be demonstrated and reviewed as necessary. Right, if we can have the next slide, please, Will. Under the Act, we then saw the development of regulations. The Act is what's called an enabling act, and under the regulations, we get lots of detail. So you may be familiar with one or all of these, but just what I'd like to do is, if you can just take a few moments, just to have a look at the Act, some of the regulations that we've put into the slides, and just have a think and maybe put into the chat some of the other regulations that you think may apply to the food and hospitality industry. Right. While you're doing that, those of you that are doing that, what I'd like to do is just to touch upon a few of these regulations. There are many more regulations. I'm going to touch upon different areas where regulations apply. But under the regulations that are stated on the screen, we've got the Management of Health and Safety at Work regulations. Now, these regulations were introduced to make it a requirement for us to have thorough risk assessments for our business. So if we have a business and we need risk assessments, and there are very few businesses that won't need risk assessments, then we need to make sure that those risk assessments are adequate. And as I say, the requirement under the Management of Health and Safety at Work regulations makes that necessary. We have manual handling operations regulations. So we can all think of manual handling tasks that we carry out within our business, things that we lift, things that we push, we pull, we lower, and to ensure that people aren't off with chronic back issues and work-related upper limb disorders. We have a requirement for risk assessments under manual handling operations. We have a requirement for personal protective equipment to make sure that it's suitable and sufficient, and it protects the person that is wearing it. So it covers obviously what's needed and the standards that need to be met for things like boots, goggles, gloves, etc. We've got regulations in relation to the provision and use of work equipment. So think of all the equipment that you might use within a food and hospitality sector. Think of all of everything from fridges and freezers right the way through to gravity feed slicers to deep fat fryers. These are all pieces of work equipment. And there is a requirement to make sure that everything that we use within the workplace is safe, and that comes under provision and use of work equipment regulations. And then we have the welfare, what's referred to as the welfare regulations, which cover the basics of health and safety and look at welfare issues like toilets, making sure that we have suitable temperatures. And certainly if we have a summer this year, there's big talk around the maximum temperatures in the workplace, as well as minimum temperatures as it used to be way back in under the old regulations, the Offices, Shops and Railway Premises Act, which preceded the Health and Safety at Work regulations. So yeah, lots and lots of regulations that we need to be aware of. Right, next slide, please, Will. But with the Act and regulations, these are all pieces of law. And actually, because they're pieces of law, that means that there are people out there that enforce these. So in terms of the regulators that we need to be aware about within the food sector, we have local authority inspectors. So local authority inspectors are the people that would generally enforce health and safety within shops, pubs, clubs, theatres, hotels, care homes, beauty salons. I don't think we've got many of those on because it is a food business 101, and so forth. So, but it is local authority inspectors that would go out. So my background is environmental health, and sometimes it's environmental health officers, but sometimes it's health and safety specialists. And what they're doing is they're coming out to make sure that we comply with the law, in the same as every other law has enforcement bodies. So what we need to do is we need to make sure that we are working within the law to ensure that we comply. If we don't comply, then we may cause something called a material breach. And a material breach is something that could be considered to be serious, that may require further action. That further action could be by way of being written to formally, asking us to take action, asking us to put something correct. It could be in terms of that formal action, it could be a notice of contravention. So we've actually done something wrong, and that's issued by an inspector. And we're seeing a big rise in notification of contraventions. because what it enables the local authority to do is to reclaim their expenses. And what we know at the moment is the average cost of a notice of contravention is in the region of about £800, and that's to cover the inspectors and the local authorities' costs. So a significant cost. We then also have improvement notices, which can be served, which gives you a period of time in order to put things right. We have prohibition notices, which essentially if something is dangerous and is going to put someone at risk, then it requires you to stop and desist from what you're doing or using a piece of equipment or carrying out an activity. And with all of that, there's also the capacity for inspectors to also take prosecutions and significant fines to ensue. Right. Okay. So next slide, please, Will. So what we've got is, and we're talking about today, is the 5 pillars of health and safety. So the 5 pillars of health and safety really should give you an indication in terms of how you become more legally compliant. So the sort of things that we're looking for businesses to have as part of our consultancy program is a written health and safety policy, to make sure that that policy is communicated effectively, and that's making sure that the people in the organization understand what it is they need to do, and the arrangements in the policy, which we'll go on to talk about, clearly communicate to the individuals the way in which that is to be delivered. We need to make sure that we assess and control risks. We need to make sure we provide effective training, which we'll talk about later. And we need to make sure that we have a review process. So we are part of the review process in terms of Food Alert and what we do with clients. But essentially, by making sure that we deliver all of those things under the 5 pillars, what we do is we hope to drive through our businesses, and I'm sure you're all on this call because you fall under this category, a safety culture. The strapline for Food Alert, ironically, we're called Food Alert, but our strapline is very much enshrined within health and safety. So HSG 65 was the HSE's platform for delivering managing health and safety successfully. And the strapline for Food Alert, actually, aside from looking at our software platform and everything being derived 65, which is where that number comes from, is plan, do, check, act, making sure that we plan for what we're going to do, then making sure that we do it, then making sure we check that we've done it, and we act in any way that's an area that we need to improve. All right, next slide, please, Will. So in terms of a policy, what we've said is we need to make sure that we've got responsibilities. So we need to put names or designated roles in terms of who's responsible for what, and that always goes up to the very top. The very top of the business needs to be the very top of that chart, because ultimately the responsibility sits at the very top, and then obviously those responsibilities are delegated down through the organizational chart. So we need to know who does what within the organization, and then what we need, aside from assigned policy by the person at the very top, which is still a legal requirement to this day, and actually still needs to have a signed policy which is clearly displayed somewhere for your staff to see, is that we then need to make sure that we've got the arrangements for the types of activities and the types of hazards that we face within our business. So those arrangements will be backed up by risk assessments, which we'll look at later. But to give an example within the policy, for example, you might have within your organizational chart the person that's responsible for looking after training young persons. So you'd have young persons designated within your policy, young persons being defined as persons that are under 18. But then within your arrangements, you may have more detail about stating what you will and what you won't allow them to do. And then furthermore, you may have a risk assessment to back up the arrangements, which then says, this is a particular activity that they can do, and this is what they can't do. So the policy and the risk assessments and the arrangements all intertwined. The key thing, though, is we need to make sure that, as well as having a policy, and in my 35 years of experience, I've seen lots of policies that have been sat on dusty shelves that have never been moved since they were written. The key thing is communication, and communicating the effectiveness of is how we make sure that our policy is effective. Okay, next slide, please, Will. So what we're going to do now is we're going to launch. No, we've done that poll. So we've got the same poll twice. So what we're going to do now is we're going to talk about risk assessments. So the key thing here is that we have a record of risk assessments. And if you have 5 or more employees, the results of your risk assessments must be written down. So we do have to have a document, even if you have less than 5 employees, and some of you may have less than 5 employees on this call. The HSE still recommends that we have something written down. It's important to make sure that we communicate those risk assessments effectively. So again, goes back to that, making sure that just having a piece of paper is great, but it means nothing if the people that need to know about what's on that piece of paper don't know. So therefore, if we're going to share that piece of paper, that risk assessment with somebody, if it's written down and we're going to share it, it's important to make sure that risk assessments are kept short as we possibly can do. Some risk assessments are very long, but it's important to make sure that we keep them short and we keep them simple, so straightforward, and we make sure that they're understandable. So if you do write risk assessments, it's important to make sure, as I say, that those risk assessments are understandable by all of your team members. And then in terms of communicating them, we need to make sure that they're given out within the workplace. So how do we do that? So generally we would recommend that you do that by way of training in meetings, training through one-to-ones, and also making sure that those risk assessments are available either in a digital or a printed format, so that your team can go to those risk assessments, review them, reread them, and understand them. So in terms of effective communication, it's not just about telling somebody. I think one of the things that I find generally when I work with clients and when we work with businesses is that there's a real rush to discharge information without making sure that information is understood. And it really is important, if you're in a responsible position for health and safety, that you ensure that you check understanding. So you make sure that you give people plenty of opportunity for feedback, plenty of opportunity to ask questions. Remember, sometimes they may have more information, more knowledge about a task or activity than you do, because they're doing it on a day-to-day basis. And importantly, make sure that you get evidence of attendance. So it's important to make sure that we know who's been at the training, who's received the information, who's given the feedback, and we're confident that they've been trained effectively. And then we make sure that we get a date to show the date and time when they participated. In terms of review, so it's important that your risk assessments are suitable and sufficient. So you must ensure that they eliminate or reduce the work-related risks that we've identified. But at some point, we do need to review them. So as a rule, the risk assessment requirements that we put into place with our clients would be for an annual review, so at least annually. And I say at least annually because there's lots of other reasons why we would review a risk assessment. For example, we would review a risk assessment following an accident or an incident. We review it not because we think we've done something wrong, but to think that maybe we've not followed the effective controls that we've got in place. But all the same, we'd need to make sure we do a review to make sure that what we've got written down is effective. We might do it because we get a complaint from a member of the team about the way in which we do things, in which case we want to make sure that we're doing it the best, safest way possible. We might do it because something breaks. We might do it because something is changed, or a piece of equipment is changed and is updated, and there may be new risks, and we need to make sure that our risk assessment is current. We might do it because we see something that's being done wrong. I've seen lots of examples through auditing and through site visits of people not following the controls in risk assessments. And at that point, you need to then review the risk assessment to get to the point where you need to think about retraining. So it's just making sure that the risk assessment that you have in place is suitable and sufficient. Right, thanks, Will. So when we're considering controls in risk assessments, one of the things that we need to do is make sure that we have the most effective solution to keep everyone safe. And I mean everyone when it comes to an activity. So what we need to do is we need to make sure that we consider our controls in the hierarchy shown. This is called the hierarchy of controls for those of you that may not have seen it. So first of all, we've got elimination. In terms of elimination, essentially what we're saying is, we've got something that's hazardous. Let's get rid of the hazard and we have no risk. So that's nice, very impractical in terms of when we're dealing with day-to-day things, but essentially sometimes it is just the only thing to consider because something may be so hazardous that we just need to eliminate. Sometimes we might need to consider substitution. quite often in the case of chemicals and cleaning chemicals, there may be a cleaning solution that's less hazardous than the one we're using. So we are obligated to ensure that we look at, in terms of our control measures, can we substitute what we're doing for something that's less dangerous, less hazardous? In which case we would consider that as the next most effective control. Then we can look down to things like engineered controls, where we might put in guarding, we might put in semi-automation of a process to remove the people at risk from the hazard. We may have administrative controls, so more regular checking, more regular supervision of something, just to make sure that things are in place. And the least, but actually quite common control, is personal protective equipment, because personal protective equipment is where we take the control and we encapsulate the individual at risk. Okay, so we do have lots of examples of PPE within the food and hospitality sector. Lots of use of gloves, goggles, I don't want to talk about face masks. We're still too close to COVID. But face masks, aprons, we've got lots of examples of this. But it is actually, by definition, considered to be the least effective and the last bastion of control. Right, thanks, Will. So in terms of the 5 steps to risk assessment, again, I'm hoping that you're all familiar with this, but just by way of recap, we've got the HSE coins 5 steps to risk assessment. So the step 1 is to identify your hazards. So identify those things that have the capacity to cause harm. So we think about things like chemicals, we think about electricity, sharp edges. So we think about hazards within the business and those things that can cause harm. Then we decide who might be harmed. So we need to think about individuals, and we need to think about individuals in terms of ourselves, our colleagues, our team members. We need to think about members of the public. Well, obviously we're working in food and hospitality, so there's nearly always a member of the public involved, but it could be members, for example. And then we need to think about others. So think about delivery drivers and contractors and other people that come into our business. Then step 3 is we evaluate the risk. So we've got a hazard, but what is the risk? So we have electricity in all of our houses, but we don't do a risk assessment. So we need to think about the risk. So what's the likelihood that we're going to be exposed to the hazard, to that harm? And we evaluate the risk based upon the situation, or based upon the task or event or piece of equipment that we're looking at. And we decide upon what's going to make it as safe as it possibly can be. Okay, and we put we coin those control measures. And then what we do is we make sure that we record and we implement those control measures, because knowing about them and not putting them in place is absolutely terrible, because potentially there are people that are going to be at risk. So we need to make sure, if we say that something needs to happen, then we need to make sure that it happens, and we need to make sure that we record it. Okay, so recording is important in this instance, because ultimately, if it's not written down, then potentially you could argue that, as I say, it didn't happen. And then we talked about the review process. We need to then make sure that we have a review process in place, and that review process is ongoing, as we talked about before. Thanks, Will. So when assessing risk, we need to make sure that we not only assume which controls are right for our business or right for our particular task or activity, but that we consult. So we make sure that we understand based upon the information that we put down. We seek to consult. Again, communication with our teams is what we're proposing. Going to make sure that this is the best possible solution. Okay, so if you have 5 or more employees, it's a legal requirement to ensure that we make sure that we consult, because we need to make sure that they're involved. In terms of once we've assessed risk, we're going to determine whether our controls are adequate. We're going to determine, for example, whether we need more engineered controls, whether we need to make sure that we do something more. Okay, and sometimes what may be born out of that, for example, may be that we need to just undertake some monitoring. So monitoring, for example, is a way that we can assess the effectiveness of controls based upon our risk assessments over time. So an example of this might be air monitoring in a bakery, where we know, for example, that flour dust, is created, and actually, if inhaled, over time can cause chronic lung issues. So what we might do is we might make sure that we've got engineered controls in place. We might monitor we might make sure that we don't create dust, but it's impractical because we're a bakery. But then, so we're going to monitor, we're going to make sure that we carry out health surveillance, and we're going to just make sure that everything that we put in place is doing the best by our employees. And if it's not, we carry out a review process. We go revisit our controls, and we put further controls in just to make sure that, as I say, everything that we're doing is ultimately adequate. Silent pause. So I'll ask Will to change the slide again. So just really, I wanted to kind of just show you all, in case you're not a Food Alert client or you're not familiar with what we do. To the right of the slide is an example of a Food Alert risk assessment. So we do have the online platform, which is called Alert65, and one of the key modules that is successfully used by thousands of businesses is the risk assessment module. So within the risk assessment module, what you'll see, if you look at the right-hand side, is you'll see we've got a task-based risk assessment. So that task identifies what we're assessing, the date that it was assessed. This one says beer kegs. It identifies the hazards in relation to that particular task or hazard in this case. It identifies the people at risk, and it identifies the control measures necessary to reduce risks from handling beer kegs, as an example. This would be sort of tantamount to a manual handling risk assessment. Okay, so the other things that the online assessment enables us to provide to clients is the ability for them to then take those control measures and to review them, to personalize them, and to make them their own, which is important in risk assessment. It also enables businesses to then undertake a review process and to track changes, if you like, so to keep relevant, keep records of reviews as and when they happen, to monitor training as and when it happens, and to keep that evidence of training online. And as I say, it works really well within our sector. Okay, next slide, Will, please. So, like I said, in terms of working within the food and hospitality sector, it's not just about, there are so many other things to consider. When I think about the clients I look after, some of whom are on that front page, there's lots of things that we need to think about. Asbestos, electrical and gas safety, equipment safety, which we talked about, including lifts and pressure systems, fire, which we'll come on to talk about briefly in a minute, harmful substances, noise, PPE, water and radiation, slips and trips and working at height are just some of the things that I'm sure that those people watching this presentation will have to think about in relation to their business. And a lot of these things are covered by risk assessments. Okay, so we just need to make sure that we have that suitable knowledge about the things that we need to do. We need to make sure that we have an understanding about what we need to do as a minimum to ensure the safety of our teams from all of these things and more besides. Okay, and these are the things that we look at in terms of when we undertake our audits for our clients, but they're also the things that are looked at by local authorities. I think 0.3% of businesses are audited annually by local authority within the UK. Okay, so but when they audit, these are the things they look at. But there's at least as many visits that are undertaken, because issues are derived from these kind of hazards, where they're reportable, or they're reported to the HSE, the Health and Safety Executive, and they get reported to the local authority, that prompt a responsive visit from the local authority. So just because you've not had a visit and no one's identified that maybe you need to look at these things, doesn't mean to say that it's not important for you to get them right. And again, we're talking about health and safety 101. It's important to understand all of the hazards in your business so you can make sure that you've got the necessary risk assessments, documentation and controls in place should something go wrong. Right. Thanks, Will. So we've talked about communication, and it is so important to ensure that we effectively communicate health and safety to our employees. It's a legal requirement that we communicate health and safety to our employees. And the Health and Safety at Work Act requires us to ensure that we provide suitable instruction, suitable information, effective training, and supervision. So, those are 4 examples of how we communicate to our teams to ensure that we achieve effective communication of health and safety. And sometimes it's more that it's one or more of those things together. Sometimes it's not just what I'm saying is I don't want you to think if I do training that's enough, because training and then supervision ensures that that training has been understood and we can supervise people to ensure that they follow through. But also in terms of the safety representatives and safety committees regs, there's a requirement for businesses to have committees, which are great ways to communicate information, to get feedback. And I think we mentioned before the health and safety consultation with employees regulations, which requires employees to consult with employees on safety matters. So all of these things are really important to ensure that we have in place to achieve effective communication. And really, just to reiterate the point, I know we said it before, is to make sure that we have evidence to show that we've communicated. Remember, if it's not recorded, it didn't happen. Yeah, and we suddenly enter into a big legal ramble about he said, she said, he said, no, he didn't, and it's just cleaner. It's better to have that communication documented, shared with your teams. Okay, it means that messages are conveyed clearly, and you have a backup of that process. Right, thanks, Will. So we have a requirement for training. We talked about the requirement for training as one of the 4 pillars. It's important that everybody understands their role in keeping everybody safe. But like I said, to flog a point, it's important that training is effective. Okay, it needs to be making sure that we not only tell somebody, but that the person that we're telling has received that information and they understand it. Sometimes it's important to stress and to get feedback to make sure they understand the importance of what we're telling them and why we're doing it. Okay, so we need to verify that, and that's going to be through that supervision, through that constantly keeping your eyes open and making sure that people are following the training. If you do know people aren't following the training, the first thing I would do is not necessarily blame the people that have been trained, but go back and think about how do we deliver that training. So the next poll is I would like you to think about how confident are you that your staff are fully trained. So again, I'm hoping that, as I say, we've got lots of confidence in this virtual room. So are you very confident? Confident? Not sure? Are you not very confident? Or not very confident at all? So it's really just like you to think when you're completing this, how confident are you that not necessarily that you've delivered training, but that training that you delivered 1 month ago, 6 months ago, 12 months ago, could be 2 years ago, is still relevant and is still understood and is still basically very much in the forefront of your team's thinking when they do something that's particularly hazardous. Right, okay, so if we can have a publication of the results. So we've got some very confident people, which is fantastic. So I take it with those very confident people, there would be a lot of verification, certainly dealing with some very, very dedicated teams, which is great. We've got some some 47% saying they're confident. Okay, that means that obviously there's potentially some elements there that we can maybe revisit the training and potentially we might be thinking about what more can we do. And the not very confident people, I'm sure that when you finish being on this call and you go back, that you'll go back and start to think about how much more can we do, what's reasonable, but ultimately what's going to achieve me being more confident about that training going forward. Right, thank you very much. Next slide, please. So we talked about the fact that the health and safety training is important. We talked about the fact that communication of health and safety policy, the risk assessments, and what we do is important. And actually, it does derive benefits. It does derive benefits, and it's been proven. There's been lots of studies, as you would imagine, in relation to businesses that communicate well in the field of health and safety. And some of the companies that have been consulted that have high levels of health and safety engagement have derived that actually they have fewer accidents, fewer incidents, which is fantastic. Nobody wants to go to work with and think they're at risk of an accident. We have better quality and productivity, more highly motivated teams, and we definitely have a lower staff turnover, because I think getting that communication message right, and actually people being involved in that process, really shows as an employer that you care. And I know sometimes it's very easy to underestimate, particularly in food and hospitality with a very transient workforce. But it's important that we make sure, as I say, that we look after the teams that are doing the work for us. Right, we've got a few more slides, so I'm just conscious. I think Will's given me I can feel a stare from Will at distance. So we have the next slide, please, Will. So one of the key things that we need to be aware of is accident reporting. So we do need to make sure that we record accidents. We have a legal requirement to record and report accidents under the UK Social Security regulations and under health and safety legislation, which is RIDDOR, which is above. So as an employer or a person in charge of a premises, or even if you're self-employed, you have a responsibility to report accidents. And we've got the details of the reportable accidents in the slide above. In terms of when you should report accidents, so a report should be raised within 10 days of an incident. Okay, if basically someone's been off within and that accident has resulted in a 7-day incapacity to work or to continue with your day-to-day work activities, then you have up to 15 days, because you need to be aware that the fact is that they've been off for that period of time. Okay, so it's important to make sure that we keep a good record of accidents, all accidents, and we have a good reporting culture. Right, next slide, please, Will. And then don't forget the basics. So this is not a fire 101, but just to be aware that fire safety is very important. It's obviously, we've got fire officers that do enforce legislation within our business, so we need to make sure that we have risk assessments there. We've talked about risk assessments again. Risk assessments for fire generally aren't simple documents, so you need to make sure that you have the necessary technical expertise and qualifications and experience for those people to undertake fire risk assessments, and that we also, like with any risk assessment, that we follow through in terms of the findings and the recommendations that are made. Okay, competence is absolutely essential. So again, have a look at your fire risk assessment when you go back. Have a look at how, when was it last done. Have a look, make sure that you followed through on all the recommendations and all the actions. Make sure that it was done by a competent person. And ultimately, if you have any thoughts around you might need to get it redone, then certainly get in touch, because we have the capacity to help with that. And then we've got first aid. So again, making sure that, as I say, we have suitable and sufficient first aid provisions within the workplace, that we have people that are first aid trained, and we make sure that, as I say, we're looking after people just in case. We have a legal obligation to make sure that we provide first aid provisions to our employees, but we have a moral obligation, which I think was borne out during these London Bridge attacks, to make sure that we can also potentially provide first aid provisions to others, like members of the public. So having first aid in place for your employees, absolutely, and actually for others, I think is definitely a moral obligation. and then making sure that we have good hygiene and housekeeping. Hygiene and housekeeping is just that is very 101. But you walk into a business, if the hygiene isn't correct, and obviously we are Food Alert, so we look at hygiene in all kinds of ways. But housekeeping in terms of storage of boxes, storage of equipment, things on the floor, all of these things can lead to accidents, slips and trips. So we need to make sure that we have absolutely good basics of hygiene and housekeeping in place. So that's kind of really a touch upon, very whirlwind touch upon health and safety 101 in the food hospitality sector. What I'm going to do now is pass you back to Will, who can do a bit of talking. Thanks, Will, for clicking through the slides. He's going to talk to you a little bit more about how Food Alert can help in other aspects of your business.
So thank you very much, John. So obviously, how can we help? I'll count a few of the ways. We've talked about a lot of different things today. Obviously, some of you are very confident. Some of you might need a little bit more help. So we have, as I mentioned at the beginning, many different customizable solutions. The first two here, the compliance membership and Nutrition Plus, are the more ongoing membership, services, all encompassing compliance membership that will do all of your auditing, your HACCP risk assessments. You get a 24/7 expert advice line. We'll stand beside you for any food complaints or allergen issues, and help you with all of your enforcement visits and any signage that you need. Whereas we also offer more one-off menu checks and allergen checks, the label checks, to ensure that all of your labeling is compliant. So just depending on the size and complexity of your business and what it is that you need, you'd be able to talk to an individual like myself to find out exactly what would work for your business and your budgets. And then the different softwares that we offer those solutions through are the Check 65, the central hub for all your compliance documentation and certifications, and Alert 65, sorry, for this central hub software. And then Check 65 is the daily due diligence app that pairs up with that. So it digitizes all of those checklists, the daily, weekly, monthly, annual checklist that we were talking about, with your risk assessments, but also with just the opening and closing, bar checks, things like that can all go on there. You can keep track of what job roles need what training and when they've completed it. So you have those records 2 or 3 years down the line if someone were to put in some sort of a dodgy claim against you. And then you have the Assure 66 Nutrition Plus, which is the allergen ingredient and nutritional information software, and then just Assure 65, which is our enterprise version of that. Obviously, you don't have to take my word for it or John's. We work for Food Alerts. We're quite biased, but you should listen to other people that use the service. As you can see, you may have looked at us already online, but our client satisfaction rates are through the roof. People feel less likely that anything will go wrong. They're more confident when an EHO officer shows up. They believe that it's made their business more efficient, and most importantly, that the services are a good value for money. So if you haven't already looked into those online, I highly encourage you to do so after today's session. And now we open it up for any questions. You can just pop into the chat and either myself or John will pick those up.
I think we may have covered everything, Will.
Okay. Looks like we've got resounding silence, which is fine. Please don't hesitate to reach out later for a copy of the recording. You can also speak to, like I said, myself or another one of the experts here at Food Alert to discuss how we can tailor a solution to fit your needs.
Yeah, I think we'd love to hear from you because obviously we are hospitality. We work in hospitality, and at the end of the day, we are as one generally with our clients. So if you do want to talk to us, if you do want more advice and information, then certainly get in touch.
And thank you all for attending today. We really enjoyed being able to present for you, and hopefully you enjoyed it as well. Oh, thank you for some of the responses there. We'll be sure to reach out to you. If you haven't already left an email or a phone number in your registration, please pop it into the chat or shoot it over on a message to one of us, and we'll get out to you right away.